Hey guys, Coach Seiji here. Um, Still pre surgery, making some decisions still, but attempting to maintain as much as my quadriceps knee extension function as possible. One of the key things, both pre and post surgery, is to maintain as much of your extension as possible and then get it back as soon as possible. I'm using an electric muscle stimulator while I'm voluntarily extending my knee to try to make this happen. My leg has shrunk a lot just from partially unloading it during the day. It was kind of shocking how much it shrank, how fast it happened. That's the reality of a traumatic knee injury. Anyways, that's what's going on. I'm also doing some resistance training, some hip and knee extension exercises. I've been instructed to not go past 90 degrees of flexion at the knee since I have meniscus damage, both medial and lateral. I'm doing everything I can to go in as in good shape as possible so I come out better. And that's what's going on. And we'll talk to you soon, all right? Trying to do these straight leg raises, which are absolutely the hardest ones out of all the quad sets. This is like 10 minutes in and I finally can do it. Okay, so I potentiated my quads, which are obviously trying to turn off by using the isometric and isotonic unloaded quad sets under electrical stimulation. I've been doing different resistance exercises, hip and knee extensions. These are just the two I'm going to do today. I'm going to do step ups, which, before I got hurt, I really didn't have to think about. It was really easy, but now I do have to think about it, keeping everything lined up, not throwing my hip out, trying to keep my knee back, and that's what I've got with my affected leg. 20-pound weight vest, and just to do something else bilateral, I'm just gonna do an air squat. Pretty humbling. Trying to move forward, do what I can. That's it for today. I've really appreciated Dodo's never more than 3 feet away from me since I got hurt. Somehow she knows something is wrong, and she's my fan club for now. So catch you guys later. Well, here we are. We're back on the trainer. It's the only cardio I can really do right now, and it's probably the only cardio I can do for a while. Anybody who race bikes with me knows that I don't like doing indoor cycling normally, but when it's all you got, it's all you got. And I've actually been looking forward to getting up in the morning and getting out here and spinning. It definitely makes my leg feel better. I can't stand on the pedals. It doesn't hurt, it just feels really weird. Like my kneecap's about to blow off, so gotta stay seated. I've been trying to gradually work into some high RPMs as the ride goes along. Pretty much maxing out at about an hour right now. So we'll see you soon, and I'm glad that I can at least do this. So I just wanted to add that since this stationary cycling is pretty low intensity, I've been doing it fasted in the morning after an overnight fast. Just, in case it does stimulate some better fat metabolism and increase my insulin sensitivity. Might as well work on stuff like that while I can, and basically while all this intensity is very low. So here's what I have to do after every pre-surgery exercise or therapy session. I have to put my knee under compression and cooling. That is an Oster cold rush device. It's essentially a cooler with a water pump. You put ice and water in there and it circulates that cold, ice cold water through these pads. It's very common with this injury that you start losing your ability to fully extend your knee, and that is now starting to happen to me. So I'm actually pushing gently down on my knee to get my knee to go to extension passively. I'm just thinking the less I lose now, the less I'll have to gain back later. So working hard to get that full extension. All right, that's it. Hey, so another thing I'm working on pre-surgery is basically not limping. There's a way you can walk with your quads disengaged. I'm sure you've seen it in people who are hurt. They swing their leg around and they reduce their knee flexion extension. So trying really hard to deliberately walk with the right motor pattern. This will help maintain those correct motor patterns, hopefully. Hey guys, Coach Seiji here. I wanted to go over my choices in surgeon and the type of graft I'm going to use for my ACL reconstruction. Both of these are super personal decisions. I don't really think there's a right or wrong answer. I'm just going to tell you what I chose. And I mean, I took a long time, a lot of research, a lot of talking to figure out what I eventually wanted and my reasons. Again, super personal decisions. You know, you should go with, if this happens to you, you should go with both what you're comfortable with in a surgeon and what you're comfortable with the graft and what the surgeon's actually comfortable with as far as the graft. I interviewed 3 surgeons, so I definitely did my due diligence. First off, I talked to Dr. Ting in California, who I've known for over a decade, and he's taken very good care of all my professional athletes, and I have the utmost confidence and trust in his opinion. And so he, of course, offered to basically do the surgery which way I wanted to do it, whichever graft I chose. Interviewed 2 more surgeons and came down to basically the older, more experienced Ting, who's done probably hundreds of these, versus a newer guy who was only 2 years out of a Andrews Fellowship. You know, dude's in his 30s, and when I saw him, it kind of took me aback how young he was. But eventually I did choose the younger surgeon, Dr. Rodriguez, here in Austin for Texas Orthopedics, because 2 big reasons. One is being a newer surgeon, he might know some newer and better techniques, and he would be less prone to saying like, oh, I've done it, you know, hundreds of these and I've done it this way and this is the way I'm going to do it. So that was one reason. The second reason was his attitude. You know, being 49, and having very significant damage, I kind of asked him, hey, do you think I'll have to, you know, what should I give up? You know, I could let go of trail running. That's okay. And he kind of looked at me all puzzled and was like, why would you be here if you thought you had to give anything up or any level of performance? And I mean, if I thought that's what you thought, I probably wouldn't have talked to you. And if I thought I couldn't get you to where I think you need to be happy, I would have tried to refer you out. So that was really good to hear. And I mean, if there was a tipping point, that was kind of it. And then he did the great professional courtesy of actually calling Dr. Ting. And Dr. Ting immediately got a hold of me. It was a weekend, it was a Saturday, and said, hey man, this guy's on it, you know. I don't have any problems you know, trusting him to work on you as a friend. Also, the newer guy was up on the biologics, so even though it's not covered by my insurance, I'm electing to do some PRP at both the harvest site and my meniscal repair. So that's something a newer doctor would be more open to, I think. So the type of graft, again, no real right or wrong answer. I'm going with the patellar autograft. The big reasons are it's a chunkier bone, piece of your patellar tendon, and a chunkier bone. And I just think it'll integrate better at the anchoring points at my femur and my tibia, since it's my bone and then it's my tendon. I mean, there's really no rejection issues, very small rejection issues with cadaver grafts, you know, these days, and they're not irradiated anymore from what I understand, so they're a lot better. But I mean, if it's 0.0001% better integration because it is my own bone, I'm taking it. I know I'm taking a little bit of risk for future anterior knee pain from the graft site, but ultimately I wanted the strongest graft, particularly in the first 6 months. You know, depending on what literature you read, all the grafts sort of even out past the first year. But like I said, even if I could take a little bit of gain in strength and stability, and for a little, you know, I'm probably giving something up. You know, everything's a compromise, and maybe I will have some interior knee pain I'll have to deal with, and my recovery might be a little bit longer. But I'm just trying to give myself the best advantage possible, and that was my personal logic. So there you go. Those are my choices and my reasons. Surgery is tomorrow. I'm not gonna lie. I'm pretty nervous. I'm not really nervous about the pain afterwards. I'm just really nervous about the ultimate outcome. And I know my nervousness isn't going to help anything, but I'm a human being, and I've been active all my life, and I've never had a knee problem and never had an injury nearly this bad and never needed surgical intervention of this magnitude. So, a little scared. But surgery again is tomorrow, and hopefully we'll talk to you soon on the other side. Thanks. Hey guys, so a dose of reality for you. Felt pretty good, coming home from surgery. I had the nerve block going. I guess there's two of them, one for the front and one for the back. And I've got this drip going into my leg, and exactly 24 hours. I mean, it was like to the minute. They told me the rear nerve block would just stop, and then the nerve block with the drip in it would just kind of dull the pain, and it would start hurting really bad. And this is like no joke. It hurts bad. I've never had anything hurt this bad. So just don't get all happy when you get home and you're like me and you're like, oh, this is not that bad. I'm a little disappointed. I had some suggested physical therapy to do today, and I couldn't hardly do any of it. I'm not trying to brag, but it's almost the first time ever that I couldn't do prescribed exercises, or even, normally I do more than what is prescribed, and it's the first time I didn't even come close to batting average for what was sent. So super disappointed in that, but I also know not to push it. I mean, I can't push it. It hurts so bad. I couldn't push it if I tried. So just a heads up, man, don't get all happy when you get home because it feels all right. I'm on a double dose of Oxycontin, and it's still just, I try to move it and it's unreal. It's just a little warning. All right, see you soon. Hey guys, so I did my first real mobility set. It's the day after surgery. It took me pretty much all day to be able to get here. I had to double up my Percocet when the nerve block wore off. It was really bad, but now I'm finally getting on with it. So this little pouch has a ball in it full of some kind of Novocaine derivative or cocaine derivative. I don't know. It drips into my leg right here. And it keeps the front of my knee where the patella graft was from being too bad. All I was able to do today was glide my heel in to about 60 degrees. My wife had to pull my leg up and do it for me, and then did that 5 times, and then go into passive extension, which is just straightening my leg. She had to push down on my thigh, and did that 5 times, hold that position for 10 seconds each time. I sat up and did some basically hamstring stretches, which is incredibly hard right now. And I'm about to unwrap my leg to move my patella around in the 4 directions. So that's all I can muster up today. It's kind of the reality of how limited you are the day after surgery. So wish me luck, and we'll take it day by day. Thanks.